Have you been injured, had some type of exam, maybe even some imaging, and told everything looks normal? Do you still hurt and don't know what to do next? Don't worry, you're not alone. A frequently missed injury from a spine injury is ligament damage, and this is part 3 of a 4-part series. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with ligament injuries for decades. Please know, these are not a substitute for medical or chiropractic advice. These videos are not a substitute for diagnosis or for treatment. These videos are for informational and educational purposes only. Now, seeing the wrong doctor following a spine injury can result in an incomplete diagnosis, the wrong treatment, and persistent pain with poor recovery or sometimes no recovery. So in this 4-part series, we've already discussed what a normal ligament is and what its properties are, and then why these are missed in terms of an appropriate diagnosis. In part 2, we reviewed what an injury looks like. In this video, part 3, we're going to review the role of chiropractic care in the management of ligament injuries. And in part 4, we're going to discuss how long recovery takes and kind of different types of self-care. Now, moving on to a ligament injury. As we discussed before in a prior video, there's 3 grades of injury. There's a grade 1, grade 2, grade 3. Grade 1 is where the ligaments are injured, they're tender, but there's nothing that's seen on imaging. Grade 2 is a moderate injury, and this is where there's a partial thickness tearing of the ligament. And then grade 4 is total rupture of the ligament. So first thing I want to tell you is that if you've got a grade 3 total rupture of a ligament injury, you should not be in a chiropractic office if the ligament injury is in the spine. That is something that needs to be managed in another provider's office. Now, regarding grade 2 and grade 1 injuries, the common concerns are, will chiropractic care hurt me? And the answer is, yeah, if you see the wrong doctor, absolutely. It can be if you get the wrong treatment for the wrong injury, yeah, it can hurt. You have to be very careful who you see. If you have a ligament injury to your spine, you have to see somebody who is trauma qualified, trauma trained, and has the education, training, and experience to handle these things. So education is basically the formal education that you would get from an instructor. Training is where there's hands-on treatment, where they're given the experience to go over and use their hands to diagnose and assess these injuries, order the right imaging. And then experience is, you don't want somebody that was trained and had real world experience 20 years ago. You want somebody who does this on a regular basis, so they're so familiar with it that they have the ability to see a lot of the different situations or scenarios where these show up. Now, the goal of chiropractic care, as long as you see the right provider, is, of course, immediate pain reduction. Now, we're not talking about pain elimination, but you really should start feeling better right away. And then the goal after pain reduction is to start improving function. Function with ligaments is basically range of motion and stability. Ligaments hold bones together. They're straps that hold bones together. And these bones are called joints, where there's 2 bone surfaces that meet, and it gives you the range of motion. Also the ability to bend over and pick up something such as a pencil or a load of laundry or a sack of groceries. So that's the overall goal. Now, in terms of treatment, there's usually several types of treatment. Now, any medical co-management, that's where the medication would come in. There's other professions out there. You can get a nurse provider to give you pain medication, things like that. So as a chiropractic profession, we have elected not to pursue prescription rights. You can get that anywhere in the healthcare community. But in terms of the chiropractic treatment, there's the hands-on treatment. This is what the doctor does for you. And this is called spinal adjusting. Now, there's high force and there's low force. Most of the time, you are way better off starting off with appropriate low force adjusting. That is how we do it here in our clinic. Low force adjusting is where the joints are reset. They're put into their normal motion and position using hands or using equipment, and it's comfortable. There's patient feedback and there's good patient tolerance. Now, the other thing that happens when there is joints that are injured and there's ligaments that are injured, these nerve endings, as we talked about before, that communicate pain, joint position to the body. If the joints and these ligaments that are damaged, when they're painful and they're symptomatic, they communicate information to the surrounding musculature and to the central nervous system. That data that is communicated in an injured joint becomes what's called corrupted. So you start having corrupted neurological data that comes out of those injured tissues. That corrupted data will then cascade and spread over to the surrounding muscles, go into the central nervous system. This will oftentimes result in a localized muscle spasm in and around the joint where there's ligament damage. So appropriate chiropractic treatment that reduces pain will oftentimes instantaneously start to bring some of those muscles back online, because then the nerve endings start to communicate more appropriate rather than corrupted neurological signaling. There's a research paper that explains this very well. There's actually several out there. But this is one of the mechanisms by which chiropractic care works. Now, as the patient starts becoming less painful and has more function, sometimes it's very appropriate to use some of the more traditional higher velocity chiropractic adjustments, but that is way down the road after the patient has a track record of improving under prior chiropractic care, and there has to be a need that would explain why you would want to do that, because the potential for injuring the tissues, it's there, and so you need to see somebody who does this appropriately. Last but not least, there has to be a patient portion to the recovery. Now, the patient portion to the recovery is called rehabilitation, and rehabilitation is the restoration of normal form and normal function. Form refers to shape. So let's use something that's not spine. So think of the foot. If the foot is injured and there's a loss of an arch, oftentimes we'll see somebody that has orthotics given to them to put the normal arch back in. So that's called normal form. And in spine rehabilitation, especially in the chiropractic field, that's called structural rehabilitation. That is something that some chiropractors, with the training and education that can be done, we work on putting some of that normal structure back in to the best extent possible. And then there's the restoration of normal function. And this is what most people assume rehabilitation is. This is where we start recovering range of motion, spine endurance. Being able to sit at your desk requires ongoing muscle activity. And so training that endurance back into the neck or into the lower back, wherever the injury might be, is vitally important. So to wrap this up briefly, these injuries require rehabilitation. They require a combination of doctor-provided care that has to be very selective, very intuitive, and in line with the patient's tolerance, patient preference, and the patient response to treatment. There also has to be a patient side to the care that includes forms of different stretching, forms of different exercise to recover the normal function in and around those areas. And a lot of times, if the damage is somewhat extensive, there is going to have to be some sort of muscular stabilization to overcome some of the underlying weakness, at least during the recovery period of these injured and damaged ligaments. So thank you so much for taking the time to watch this video. You have a lot to pick from. I'm honored that you chose this one. If you or somebody you know has a spine injury that's not getting better, more than happy to do an evaluation and assess you and see if there's some sort of missing imaging or some sort of missing diagnosis, whereby once it's identified, you can take your recovery to the next level. Thank you so much, and until we meet again, be blessed.